Thank you everyone for being here. I'm so excited to be here today with Dr. Shalika Katugaha. She is our System Medical Director of Infectious Diseases, and she is my go-to person for all things COVID-19 vaccine. It's been a while since we've been together, so we're really excited to have her back as we've had a lot of news recently around the COVID-19 booster. So she's going to start off by giving us an overview, and then we'll answer some questions that were submitted in advance, and we will answer any questions that you have. So the chat box is open. I'll be reading questions out of the chat box to Dr. K. She goes by Dr. K as well. So let's go ahead and get started. Dr. K, thanks for joining us.
All right. Hi, I'm so excited to be back and to talk to you, and thank you for spending your lunchtime with me. So we're talking about our big topic today is booster doses. And so there are three different categories, which are actually a little bit different. So this is how we'll have to think of them. So number one is the additional dose, which is actually different from a booster. So that won't be the main part of what I talk about today, but it is different from a booster. So additional dose versus booster dose. And then within the booster doses, there's a difference between the mRNAs, the Moderna and Pfizer, versus the Johnson & Johnson Janssen vaccine. So within that, there's two separate sections as well. So first, let me start with defining some words. So I've circled in what Wesley's showing you, primary series. So a primary series refers to either the two first doses of Moderna or the two first doses of Pfizer or the initial Janssen vaccine. So that's what we call the primary series. So what the additional dose is a dose that's given to people with a weakened immune system who likely did not mount a protective immune response after their primary vaccine series. And this is in hopes that they do mount a response by giving this third or additional dose. A booster dose is different. It's a subsequent dose of vaccine that's given after the primary series when immunity seems to have waned over time. So that's what a booster dose is. So if you are moderately or severely immunocompromised and over 12 in terms of when we talk about Pfizer, or over 18 when we talk about Moderna, then you should get an additional mRNA vaccine at least 28 days after the primary series, and that's the additional dose. So the additional dose is only when we talk about our mRNAs. So for Janssen and Johnson & Johnson, there's no additional dose. There's only the booster. So we're going to talk about the booster in just a moment. So that's the additional dose. And now we jump into boosters, which is what's on everyone's mind. So just to say before I go into this, the continued top priority of the world, the nation, of our government continues to still be to vaccinate the unvaccinated individuals. That's the only way we will achieve herd immunity and end this pandemic. So that said, the goals of a booster are to protect against severe disease like hospitalization and death, and then some other outcomes like maintaining our workforce and healthcare capacity and preventing transmission. So do we need a booster? So the answer is yes, because emerging evidence shows that in healthcare, frontline workers, vaccine effectiveness wanes over time, and then that this lower effectiveness is due to time passing and also due to new variants. So now the picture from Wesley's screen, I actually wrote it instead of putting it in a PowerPoint slide presentation because I really do want this to be more informal and I want you to jump in, and if you have questions, write them in the chat. And this is more like you and me talking than me lecturing per se. So now after the Pfizer and Moderna COVID primary series, so after the first doses of either, there's a category that's in blue that should receive a single booster 6 months after the primary series. Those are individuals over 65 or at 65, people who are 18 and reside in a long-term care facility, or 18 or older, and people who are 50 to 64 with certain underlying medical conditions. So those are people who should get a booster. Now, the CDC writes that those people in the green may receive a booster 6 months after they got their initial dose. And so that is if you are 18 to 49 with certain underlying medical conditions, or if you're 18 to 64 and at increased risk of exposure and transmission because of occupational or institutional setting, where you work or what you do or where you are. So now, what is a high-risk setting? Who are these high-risk workers? So Leslie has zoomed in kindly on this post-it, and you see many people fit into this category. So first responders, who are healthcare workers, firefighters, police, educational staff, who are teachers, support staff, daycare workers, food and agriculture workers, manufacturing workers, corrections workers, U.S. Postal Service workers, public transit workers, grocery store workers. So I know the question probably most relevant to many here who have joined is that what if you work at Baptist or work in a hospital, but you're not necessarily involved in patient care? Well, as you can see, the boundaries are not very clear. And it's really if you're at risk because you think you'll be in a flow of people or in a lot of traffic where people may have COVID. So what I would tell you is if you're wondering and thinking, am I one who should get a booster? The answer is probably yes. You can certainly reach out to me or your healthcare provider if you're not sure. But generally, if you're in this hospital setting, we are at a setting where there is a lot of COVID just based on what we do. So then, individuals with underlying medical conditions. These are people who are more likely to get severely ill from COVID-19. Becoming severely ill means that someone who with COVID can get hospitalized, can die, can need intensive care, need a ventilator to help them breathe. So now I have on this side underlying medical conditions, and you can see that it's a long list. That said, it's not an all-inclusive list. So if your doctor thinks you have a medical condition or you have a rare condition that's not on this list, then by all means, you are still eligible for a booster. So I'm just going to briefly run through it. So underlying medical conditions are cancer, chronic kidney disease, so anyone on dialysis, chronic liver disease, so alcohol-related liver disease, fatty liver disease, autoimmune hepatitis, chronic lung conditions, so that's asthma, bronchiectasis, COPD, if you have scarred lung tissue, cystic fibrosis, pulmonary embolism, pulmonary hypertension, those are all chronic lung disease. Dementia or underlying other neurologic conditions. If you have diabetes, if you have Down syndrome, if you have heart conditions, so that's coronary artery disease, heart failure, and possibly even if you just have high blood pressure, you're still eligible. HIV infection, or anyone with an immunocompromised state or weakened immune system. So what this means is this group with a weakened immune system with HIV, they would have gotten an additional dose and are also candidates for the booster dose. So this group will eventually end up getting 4 vaccines, actually. All right, other underlying medical conditions. If you have mental health conditions, so that's mood disorders, depression, schizophrenia. If you're overweight, defined as a BMI over 25, or obese as a BMI over 30. If you're pregnant, so if you are pregnant, you're at higher risk of getting severe disease from COVID. So even if you're pregnant, you should be eligible and getting a booster. If you have sickle cell disease or thalassemia, if you are a smoker now or ever smoked, if you've had a solid organ or stem cell transplant, and that's that weakened group that would end up getting 4 vaccines, if you've had a stroke or cerebrovascular disease, if you have a substance use disorder, so this is alcohol, cocaine, opioids, anything, and if you have tuberculosis. So I listed out a long list. So that means, around 85% of adults in the United States are eligible for this vaccine booster. So that's a whole lot of people. So that is mRNAs, and I listed to you these underlying conditions, healthcare workers. These words and concepts don't apply to the Johnson and Johnson Janssen vaccine. So the recommendation following one dose of the Janssen vaccine is that anyone and everyone aged 18 should get a booster 2 months after they get that Janssen vaccine. All right, so that's the difference. So now there's this word that's come about called mix and match. It actually has a scientific name, which is heterologous boosting. So what that means is that after the primary series of any of the vaccines, so after the primary series of Pfizer, Moderna, or Janssen, someone can go get a different product as their booster. So you can have 2 Pfizers and get a Moderna 6 months later. You can have 2 Modernas and get a Pfizer 6 months later. You can get a Janssen and then 2 months later get Moderna or Pfizer. And also, if you've gotten the mRNA series, you can still get the Janssen vaccine. So this is mix and match. So I want to mention that this mix and match approach is only for boosters. It's not for the third or additional dose that people with a weakened immune system are getting. So why did this happen? Why is this okay? Well, it's because in studies, people who got this heterologous boost or the mix and match boost did actually similar or had higher serologic responses than those who got the same dose. And there were no safety concerns. So there's good data. The study arms were a little smaller with these mix and match doses, but there's good data then for both, for either way you go. So the reason that the public health officials aren't telling you one way or the other is because both are good. And so that's the way to see it. There's no clear winner and you can do as you wish. So when it comes to boosters, just to people ask me all the time, are they the same dose? So for Pfizer and Janssen, they are. For the Moderna vaccine, the booster is half the dose of the initial vaccine. So how do you decide then? Because it's so hard, right? When no one tells you what exactly you need to be doing. So it's a risk benefit assessment for each individual, and it's an individual decision. So one is based on availability. If you can get whatever product you can get easier, faster. So we're at our health clinics, we give Moderna. If it's easiest to just pop in and get that at one of your clinics, then do that, because it's better to get the booster than push it off and wait for weeks. Another might just be, oh, I did well with Pfizer the first time around. I'll just get myself a Pfizer this time. That's completely understandable. Another is if you have underlying medical conditions or you have a side effect profile, then check in with your doctor. So for example, the mRNAs are more associated in younger males with myocarditis. So maybe if you're in that age category with those risk factors, that may not be the vaccine for you. Or for the Janssen vaccine, there are certain blood disorders and clotting disorders associated. So reach out to your provider to find out about that. So if all's well and all's the same and you have nothing and you're young and healthy, but a healthcare worker and trying to figure it out, I will just tell you what I did for myself, because again, I don't want to say there's one way you have to go, because you can go both ways. But I got 2 Pfizers and then I got a Moderna booster. So I actually am a fan of this heterologous boosting. And then I have my mom and dad ended up getting 2 Modernas, and I gave them advice to go get a Pfizer. So, as you wish, but that's my thinking on it. So other little tidbits that I get asked all the time, and then I'm just going to open up for question. I know I've been talking for a while. Does the booster mean that the vaccines aren't working? So the COVID vaccines are working very well to prevent severe illness, hospitalization, and death, even in the situation of the variants. But health experts are starting to see the protection wane in certain populations against mild and moderate disease. So yes, vaccines are working. Boosters are just what they are, a boost. What are the risks or side effects of getting a booster shot? They're typically the same as the initial series. So headache, fatigue, fevers, pain at the injection site. That's really what you would see or expect. Am I still considered fully vaccinated if I don't get a booster? Yes, you are. You are considered fully vaccinated after after your primary series. So after 2 shots of Pfizer or Moderna, or 1 shot of Johnson and Johnson, 2 weeks after those series. And then are additional populations going to receive booster shots as more data is available? It's to be determined, but it is very possible. We are not, we're not at the end of this yet. We're still kind of a moving target. A little extra tidbits: when you head out to get your vaccine, please take your vaccine card with you so that they can see what you got before and appropriately document. And then, even though Baptist is not requiring vaccine boosters, by all means, if you get a booster, let employee health know so that they can keep track of that. So I believe that is all I have, Leslie. So we can go on to questions.
Perfect. So we've had 2 questions in the chat so far. So anyone on the line, you can drop questions in the chat. The first one is, do you think that the COVID-19 vaccine is going to be like the flu vaccine where we have to get it every year, or are we still waiting on more data?
So the official answer is we are still waiting on more data, and science does not know yet. It is to be determined. My personal thoughts are that it probably will be more like a flu vaccine that we have to do in a repeated sequence.
Perfect. And if your patient asks for advice on what vaccine to choose as a booster after their 1 Johnson & Johnson vaccine, what would be your recommendation? So thinking about it from the caregiver's perspective with people asking them.
So again, there's no one right answer for everyone. So if this patient has a unique side effect profile, then I would take that into consideration. If one is easy for them to go get, I would take that into consideration. If all things are the same and they got the Janssen vaccine, I think 2 months later, a good strategy might be to go get Moderna.
Perfect. Thank you. And someone shared that they did not feel well after their second Moderna vaccine, but they did feel well after their booster and only had a sore arm. I've heard that from more than one person. So that's good news. And thanks for sharing that.
Yes, it's promising, right? Yes.
It sure is. When might we see the vaccine variation? I don't know the correct term, but based on the variants that we're seeing, when might we see the vaccine change?
So scientists are working on this right now. They're looking at variants and how to modify vaccines. I don't think that in the next year per se it'll be necessary, but I do think that, scientists are studying like a combined COVID flu vaccine. They're studying modified COVID vaccines based on variants. I would say in around a year or so, we might see new vaccines pop up.
Perfect. Because we saw more breakthrough illnesses with the Pfizer vaccine, do you think it's wise to recommend all of our patients older than 18 get a booster?
All of our patients with say it again.
Well, do you recommend all of our patients older than 18 get a booster? So it sounds like that goes back to the eligibility at this time.
Yeah, it's if they're eligible. So if they got the mRNAs, it'd be if they fall in those high risk categories. If they got the Johnson & Johnson, then anyone can get it.
Perfect. So we did have 2 questions submitted before the session. So thank you. If you're on the line and you submitted these. Did cover their first question. Are you recommending the booster for pregnant women and women who are trying to conceive?
Yes, we are. And I wanted to actually, just going back to the other question, just in case I didn't understand it, my personal recommendation is that anyone who's eligible should go get these vaccines. So if you're a care provider and you're wondering, do they fall in these eligibility categories, they fall in this maybe deserve the vaccine or eligible, then I would say, yes, if you're eligible, go get the vaccine. And then certainly if you're pregnant, please talk to your OB. But pregnant women become severely ill from COVID, so they would certainly be eligible. And I would recommend that they get the booster vaccine.
Perfect. Thank you. If a pregnant patient has had COVID-19 recently, would you check antibodies on that patient, or would you just recommend the vaccine or the booster? I guess this can go for everyone eligible, not just pregnant.
Sure, I can just answer because this is what I get all the time about checking antibodies. So we are not there. there's no recommendation from the CDC to check antibodies, except in very unique situations, I would check antibodies. But in the general public, including in pregnant women, we're not checking antibodies. The reason is, okay, if you get antibodies, great. That's nice. That means something happened to you after the vaccine. But we still don't know what level of antibody is protective. So we don't know if you got this level, is it protective against getting COVID, severe disease? We just don't know. So the test only tells us so much. And then the test isn't necessarily standardized either. It's not like every lab measures it the same way because it's so new. So antibodies, they may be helpful in specific situations, but overall, we're not telling the general public to go get antibody tested. We're certainly not saying that to pregnant woman. I think maybe this question comes from a fear that I'm pregnant or someone is pregnant. Should they really get the vaccine, especially if they have some degree of natural immunity? And so the answer to that is still the same, that the answer is yes. And then, even if we're dealing with this all the time now with looking at vaccine exemptions, even if someone has antibody from natural immunity, that doesn't mean that getting the vaccine in any way is negative. Getting the vaccine is still even more helpful and more beneficial. So, demonstrating antibodies, it only helps so much.
Next question from a team member that we had before the session. On the CDC website, it states that there have not been studies on the effects of vaccine on babies of pregnant or breastfeeding mothers. Why is a vaccine still being recommended for these women, and can it potentially harm the babies?
So it is a tough spot to be pregnant in this COVID world, but we do have plenty of data from this clinical trials that were done on the initial Pfizer and Moderna studies of women who became pregnant and then got the vaccine. And what these studies show is that women who got pregnant and then got the vaccine, they didn't have a higher risk of any negative outcome, not a higher risk of a miscarriage, not a higher risk of premature births, not a higher risk of any complications related to their pregnancy. And so we do have that data. And so based on that data, ACOG and multiple medical societies relating to OB and GYN and pediatrics have all recommended that women who are pregnant get the vaccine. And so that is the data that we have. And then as a correlate, the data that we have about women who get COVID, who get COVID disease, they get severe disease and they end up in ICUs and requiring ventilators more frequently than their cohorts who are not pregnant. So it is a risk versus benefits situation. We all want what's best for mommy and baby, which right now is getting the vaccine.
Perfect. Thank you, Dr. K. And then I'm trying to get you back on stage so everyone can see your camera. Perfect. Hopefully you all can see her now. She is on the stage for me. Let's see. All right, we're back. Perfect. Okay, so another question in the chat. Thank you all for submitting. Keep it up. We appreciate it. We actually have a little bit longer today. We have until 1:15. These sessions in the past have been 30 minutes. So we definitely want to get to all of your questions. Someone had a sinus headache a day after they received the Moderna booster. Is that one of the side effects?
So we don't have like a full range of, not enough people have gotten boosters as when when people got the second vaccine to say, oh, this is very, very common. But certainly headaches is a known side effect, and sinus headache, it very well could be.
Perfect. So we have a question, but just curious, what's it going to take to get this pandemic, under control?
Oh my gosh, it's my favorite thing to say. We have to get everyone vaccinated. Yeah. So I've heard the words that this is now a pandemic of the unvaccinated, but it's actually, we are all in it together. So until everyone crosses the finish line, we are not done. And so that is, that's really what we have to do. And then not just get vaccinated, we still have to be careful, right? Masking in certain situations, being, using precautions when you're out with others. But, there's now hope everywhere, right? Like we are not at the end, but there are glimmers of hope. So seizing on that hope, please everyone get the vaccine if you're unvaccinated, please get the booster if you're eligible, please stay safe.
Perfect, thanks. And this is something that one of our team members on has been getting asked herself. Were there more robust studies on the booster? Some of the information seems like it's been small numbers studied for the boosters.
So that is it. The studies in boosters have been smaller numbers. They just have been. Yet based on those studies and based on a collection of smaller studies, the CDC has concluded that they are still beneficial. They're smaller studies, not only just in general about the boosters, but when we look at which is better, the same, or the mix and match, they're just smaller studies. And this is a very, this is us being proactive. This is the scientific community and the government being proactive. So
let's talk a little bit more about mix and match. You said it may be beneficial. Can we dig into that a little bit? Why might it be beneficial? What's different in the makeup of these vaccines? Let's talk a little bit more about the mix and match. I know a lot of people on the call are really curious about that.
Yeah, sure. So it's all about the serologic response, like your immune boost. And so studies found that people who got Moderna and then they got a Moderna booster saw the booster level, like the antibody levels, go up significantly, right? And so when they got, you can actually test like who gets a booster and what they do. And so these studies, the arms of the studies in which there were mix and matched, sometimes those people did actually better. They got like a certain number higher of a protective amount. And so people say, like, for example, if you got 2 Modernas and then you get a Pfizer, then that's not as good as if you get 2 Pfizers and then a Moderna. So the best situation would be, like, best situation meaning the most beneficial situation would be if you got 2 Pfizers and then get a Moderna. If you got 2 Modernas and get another Moderna or a Pfizer, both are fine. So it's just looking at the serologic response, and that's what we have. Kind of scientifically, my thinking is that these vaccine products, they're a little bit different, right? So Moderna is a little bit different from Pfizer, even though they're both mRNAs. So if your body sees a second type and makes an additional type of antibody, you may stand to benefit a little bit more. It may be a little bit broader, if that makes sense. But that being said, like the one, like, let's say you got 2 Modernas, you should still have enough to fight off COVID. So it's like a very small incremental benefit abroad. It's not like, oh, now I'm going to have 2 different types of antibodies running around. It's a very small incremental, difference.
Perfect. Thank you so much. And then we had someone again ask about just mixing, like, mix and match with the J&J and Pfizer. Mixing the J&J, I guess the question is, if you had J&J originally, is it better to get Pfizer or Moderna? Which might go back to those risk groups that you talked about a little bit. But if you want to comment on that, if you got J&J originally.
If you get, my personal belief, and based on studies, obviously, is that if you got the Janssen vaccine, then your second shot 2 months later, you'd be better off getting Moderna or Pfizer. That would be what I would tell you. And I know that we have a vaccine clinic coming up on the 16th, and that is a Janssen vaccine. So let's say you get that, and you get that because you're actually trying to fit our timeline of November 15th. Well, then 2 months later, you have the option of going out and getting a Moderna or a Pfizer, and I would certainly recommend that you do that.
Perfect. And yeah, thank you for talking about our clinics coming up. So Walgreens on November 6th is giving out the J&J vaccine for our team members and physicians, and that's downtown at the Walgreens of the Pavilion. And then we have clinics this week at South, and I believe one the following week at Jack's, and those are for Moderna boosters and flu shots, so you can get them at the same time, which actually leads me to another question. Let's talk about getting the vaccines at the same time. Can we do it?
We can absolutely do it. And we've had flu and COVID clinics here. So by all means, co-administration is absolutely possible. Seize your opportunity and get the vaccines if you can, both of them on the same day.
Perfect. Are epidemiologists expecting a surge this winter, COVID?
A little bit. So, like looking at certain countries in Europe, we are bracing ahead for. We are having a very nice time right now, countrywide and Florida-wide and hospital-wide. But we are concerned that there might be a little bit of a surge coming this winter. We're also concerned that, a lot of people got COVID at a certain time. A lot of so let's say August for us was a time when a lot of individuals got the vaccine even. So 6 months after that, will we see mini surges because that vaccine effectiveness and the effectiveness of even natural immunity wanes. But yes, we are a little bit cautious about this winter.
Gotcha. So someone asked if we're offering Pfizer boosters this month. Yes. So the upcoming boosters at Baptist Health are for Moderna, but you can receive a Pfizer booster even if you received your initial series or your primary series at Baptist Health. You can receive your Pfizer booster anywhere in the community that's convenient for you. Walgreens, Publix, vaccines.gov is a great place to search with a comprehensive list. So at this time, no more Pfizer clinics planned for Baptist Health. Just Moderna and flu shot, but yeah, you're welcome to get it anywhere in the community. And then I'll reiterate something Dr. K said earlier. If you do get a booster outside of Baptist Health, if you can send that information to employeehealth@bmcjax.com, that would be awesome. It's not required right now as part of the vaccine requirement, but it is helpful for them to have this information on file. Perfect. So anyone that might be calling in on the phone that can't type into the chat box, if you want to unmute and ask a question, we can open up to that. Perfect. Or any other questions in the chat? I know there's a little bit of conversation right now about vaccines for younger children. And can you just talk about like where we are on that and what we might see in the coming days?
All right. So the FDA approved the vaccine for the Pfizer for age 5 to 11 last week, and we are waiting for the final say from the CDC, and experts are meeting just today. So I am so excited because I have a poor 7-year-old who has not been able to do much, and I believe that within the next few days he might be eligible for the vaccine. So we are so close with children, and then we open up like a huge number of people in this country our children will be able to get this vaccine. I'm very, very excited.
Perfect. And another question, can you elaborate on when to give Moderna booster or third dose, i.e. the 0.25 milliliters or 0.5 milliliters? The criteria of immunocompromise is very wide since like diabetes is included in that.
Okay, so who will qualify for a third dose? That's if you have weakened immune system. So that's usually we talk about HIV, stem cell transplant, primary immunodeficiency disorders, or any individuals who are on an amount of immunosuppressive medications kind of equivalent to transplant. So usually diabetes is not considered a weakened immune system. That being said, if your doctor thinks you have a weakened immune system with diabetes, it could be. So that additional dose of Moderna will be the full dose of Moderna. So that's 28 days after you get the full dose of Moderna. Then when we talk about boosters, 6 months after or 2 months after, that'll be half the dose of Moderna. And that's for any of the people with underlying medical conditions. So what I'm understanding is, let's say you have diabetes and you're going for a booster, then you would get half the dose of Moderna. And if you have diabetes, just diabetes alone, that doesn't qualify you for a third or additional dose, unless there's something else going on.
Okay, perfect. Thanks for that clarification. All right, we'll hang on for just a few more minutes. I love that we've been able to get to all the questions in the chat. This says, for HIV, do we need CD4?
No, for HIV. So you don't have to get the third or additional dose. it's actually a self-attestation method, right? So let's say so if you're HIV, first of all, that is a weakened immune system. And so you're eligible for the third dose. So you would go a month after your Moderna or Pfizer and get that dose. And you don't have to show your CD4. You don't have to show details. You just have to say, I have a weakened immune system. And that should be good enough for just about anything. Like if you have cancer, you don't have to show what chemotherapy you're on or whatnot. That's pretty standard. You say, have a weakened immune system and I need the additional dose.
Okay, perfect. All right, any other questions in the chat? Okay, I have a vaccine hesitant family member who is concerned about the mRNA vaccine causing internal bleeding. What evidence, if any, do we have on this?
Of it causing what?
Internal bleeding?
So that is not, there is no real association between the mRNA vaccines, either Moderna or Pfizer, and internal bleeding. So, there are certain side effects, which are the headache, the fatigue, the pain that I mentioned. And then there are some unique effects, like, for example, Moderna and Pfizer have been associated with myocarditis, but internal bleeding isn't one of those that, is typically associated with them.
Okay, perfect. So the family member, this recording will be available, so you will be able to share it outside of Baptist Health if any of your family members or friends are interested in hearing the answers to these questions. So it'll be available on Baptist Health's YouTube, and we will share it in the weekly What's Up email newsletter that goes out on Wednesdays as well. All right, that may be it from all the questions. Dr. K, anything else?
Nope. Just go out there and get the vaccine. If you have any questions on which booster to get, please reach out to me, because it's just an easy email answer for me, and I just want you to get the booster. So please reach out, and thank you for coming, listening, and trying to stay healthy.
Perfect. All right. Thank you, everyone. We appreciate you being here today. Again, share the recording, more information about vaccine clinics, and they're all walk-in now, so you don't even have to make an appointment. All that information is available on the exchange as we come up, especially on the deadline for the vaccines on November 15th for flu and COVID. So we'll see you at the clinics, and thank you, everyone, for your time.